Thanks very much, Corla. And first of all, I'd like to thank my own colleague, Deputy Ward, for bringing this forward, and in general for all of the work and advocacy he does in relation to mental health. So Deputy Ward's motion clearly calls for straightforward reform, that resourcing is matched with staffing and that services are available when and where they are needed. And I think that's one of the key things, because my experience with CAMHS is people having difficulty accessing the service. First of all, the actual referral can be quite daunting, and then they're really genuinely fobbed off in an awful lot of cases. In CHO5, which is the catchment area of my constituency, there's 314 children waiting more than 12 months for an appointment. So that's 314 extremely vulnerable children. And just to give a really recent experience I had where a child was suicidal, was presenting to their GP, was already on the list for CAMHS for 2 years at this point. And they were being told as a drop-in psychology clinic, totally not appropriate at all. This child really needed the intervention of CAMHS because they were already undergoing some level of counselling, but we all know there's a difference between counselling and therapy, and then the very specialised intervention that some children need with CAMHS. And they actually had to present to the emergency room in the end to get that appointment. And can I say, as a public rep making representations, it was only when the appointment was given through the emergency department that then they came back to us to say there was an appointment. So I found that quite cynical in itself. My time is short and I don't want to eat into my colleagues' times, but I will just say that when it comes to children, and I say this time and time again in this chamber, we are letting our children down. In the Children's Committee today, we were listening to parents who are trying to fight for services for their children with disabilities, the most basic of services, and here we are now talking about our children with mental health difficulties being failed. So I would urge all deputies in this House, not just to support Deputy Ward's motion, but to actually ensure, I would call on government to ensure that this is actually acted upon and that we get the staff in place and that the process is made a lot easier and more straightforward for parents. Thank you, Ken Corley.